Hello, I'm Dr. Christopher Parshuram, a critical care physician and senior scientist at Sick Kids in Toronto. Today I want to tell you about a study that we undertook on resident schedules. Public and professional opinion has been profoundly shaped by powerful anecdotes describing the tired doctor at 4 in the morning. The solution, purportedly, is to reduce the period of duty that the doctor works. This has been regulated in Canada and other areas around the world. The way doctors work is a fundamental aspect of care, and so we undertook a study looking at 3 commonly used schedules in the intensive care unit: 12-hour, 16-hour and 24-hour overnight duty. Our outcomes: residents' well-being and the well-being of patients measured through accepted measures of patient safety, healthcare-related harm and harmful errors. Resident sleepiness was assessed using a valid 7-item scale. We studied nearly 6,000 patient days in 2 adult intensive care units in Toronto. We found residents indeed were sleepy overnight, most sleepy at 4 a.m. This is not surprising. However, the surprising finding was that the schedule made no difference to how tired the residents were. When we looked at patient safety, we found the overall rates of harmful errors were low. However, the majority of these errors occurred in the 12-hour overnight duty schedule. This is contrary to what many people expect, and for us was a very important message. We looked beyond this at the fatigue and the symptoms experienced by residents and found the majority of assessments had no or minimal symptoms, but that the more severe symptoms occurred more often in the 24-hour schedule. So putting this together would suggest that there's a trade-off for resident well-being and patient safety, and that what we thought was a safer approach may not necessarily be so. Our next steps, responsible next steps, need to be avoiding making change for change's sake, and to replicate this study in a larger fashion so that we can better quantify the magnitude of effects. It may be that there's no effect and an ideal schedule cannot be identified, or it may be that we understand better the trade-offs and describe small but important effects. A small effect applied across the Canadian healthcare system could in fact be of great significance to patients, their families, and also to the residents who provide the majority of inpatient hospital care. Thank you.